afternoon, ma'am. I'm Jean, one of your physical therapists for the day. So for verification purposes, may I know your name and your birthday? Alright, so good afternoon, ma'am. Kate. How are you doing? So that's good to hear. So ma'am, what's your concern? So what's your reason of coming here? So you feel pain. So when did you start feeling the pain? Can you describe the pain you're feeling? Like, is it nagging or throbbing? What exactly do you feel and where do you feel it? Okay, so do you feel the pain only in your forearm or you feel like it's radiating daily part of your body? Okay, so is it okay, ma'am, to touch your forearm? It's just that we can verify if it's really the exact location of the pain. So please tell me where exactly. Over here. Okay, so when you started feeling the pain, is it constant or are there times that it's gone but then after some time it comes back? Okay, so on a scale of 1 to 10, can you describe the pain you're feeling? So 0 being no pain, 5 being mild, and 10 being the worst. Okay, so are there any activities or positions you do that worsens the pain? Okay, so how about activities or positions that you do to relieve the pain? Okay, now we'll proceed to the next assessment, which is the palpation. So this assessment and most of the assessments that I'll be conducting will require me touching certain areas of your body. So are you okay with that? Alright, thank you so much, ma'am, for your cooperation. So we'll be palpating both your upper limbs and we'll start with your left side. So I want you to sit comfortably, ma'am. Okay, so now using my fingers, I'll be applying a gentle pressure over your skin, but please tell me if you feel pain, okay? So now I'll be coming in contact with your skin. Again, please tell me if you feel pain. So you feel pain over here. Okay, this is noted. Now I'll be coming in contact on the back side of your upper limb. Okay, so after testing the left side, we'll be testing the right side using the same procedure, and after testing both sides. So ma'am, based on my notes, you have swelling around you have swelling on the area around your posterior tracheus nerve, and there's also abnormal tenderness over your artery of Forge and also your lateral epicondyle. So basically, let me interpret this. I observed there's swelling in this area over here. So again, this is the area over your posterior tracheus nerve. So this nerve is in your forearm, that's also close to your elbow. So this swelling may also explain why I also observe tenderness in the same area and also tenderness at the side of your elbow. Next, we'll be assessing the movement of your palm, fingers, and wrist to check if there are any limitations to these movements. So throughout this assessment, I'll use this tool. So this is a goniometer, and this is what we'll be using in measuring your angle. So we'll be assessing both sides, but let's start first with your left and then right. So first, we'll be assessing the ability of your thumb to straighten at one of its joints, which is the MCP joint. So I want you to sit next to the table and place your forearm and hand on the table in such a way that your palm of hand is facing the ceiling. So I'll be assisting you. Okay, so ma'am, we're comfortable in your position. Okay, now using my one hand, I'll be stabilizing your bone over here. So this is your first metacarpal to prevent motion at your wrist and at the CMC joint of your thumb. So now at the count of 3, please straighten your thumb in such a way that it will move away from your fingers. So basically like this. Okay, so you understand? Okay, so at the count of 3, 1, 2, 3, move your thumb away. Okay, so is that the farthest you can go? Okay, now I'll be measuring it using the goniometer. So just for your information, the goniometer placement center fulcrum is on the dorsal aspect of the MCP joint. The proximal arm is over the dorsal midline of the metacarpal, and the distal arm is over the dorsal midline of the proximal phalanx. So okay, ma'am, it's measured now. So I'll be pushing the palmar surface of your bone, of your thumb. So basically this is your proximal phalanx, to move the thumb away from your fingers to see if there's still motion available. Okay, so since resistance to further motion is fault, I'll be stopping at this angle. Then I'll be measuring it again using the goniometer. Okay, so after measuring the left thumb, the right thumb will then be assessed, and after measuring or assessing both thumbs, so ma'am, based on the assessment, you have limited ability to straighten your thumb. Next, we'll be assessing the ability of your fingers to straighten at one of its joints, which is your MCP joint. So I want you to remain seated next to the table with your forearm and hand resting on the table. So are you still comfortable in your position? Okay, so this time I'll place your forearm midway in such a way that the palm of your hand is facing the side. So now I'll be stabilizing your metacarpal, so this bone over here, to prevent wrist motion. So now at the count of 3, please straighten your finger, move it away from your palm, okay? We understand? Okay, so now at the count of 3, 1, 2, 3. So ma'am, is that the farthest you can go? Okay, so I'll be measuring it now using the goniometer. So just for information, the goniometer placement, center fulcrum is over the dorsal aspect of the MCP joint, proximal arm is over the dorsal midline of the metacarpal, and distal arm is over the dorsal midline of the proximal phalanx. So, okay now ma'am, so I'll be pushing the palmar surface of the bone of your finger, so this is your proximal phalanx, to move the finger further away from the palm. Okay, so since resistance to further motion is felt, I'm going to stop at this angle and measure it again using the goniometer. So in this assessment, all fingers will be tested. So after testing the fingers of the left side, we'll be testing the fingers of the right side. So after testing both sides, so ma'am, based on the assessment, you have limited ability to straighten your fingers. Lastly, we'll be assessing the ability of your wrist to straighten. So still, I want you to sit next to the table, place your elbow and forearm on the table, and the palm of your hand facing the ground. Okay, so I'll double check to see if your position leaves your hand free to move. Okay, that's good. So ma'am, are you comfortable in your position? Okay, so now using my one hand, I'll stabilize your forearm to prevent forearm motion and also elbow motion. Now at the count of 3, please bend your wrist backward, move it toward the ceiling. So you will do something like this. So do you understand, ma'am? Okay, good. So now I want you to do that at the count of 3. 1, 2, 3. Okay, so is that the farthest you can go, ma'am? Okay, so I'll be measuring it now using the goniometer. So just for your information, the center fulcrum is on the lateral aspect of the wrist over the tricletium. Proximal arm is with the lateral midline of the ulna, using the Olecranon and ulnar stylic process for reference, and the distal arm is with the lateral midline of the fifth metacarpal. So now, ma'am, I measured it. I'll be pushing it further across the palmar surface to move your hand further toward the ceiling to check if there's still available movement. Okay, so since resistance to further motion is felt, I'm going to stop at this angle and measure it again using the goniometer. Okay, so after testing the left side, we'll be testing the right side, and after testing both sides. So now you're able to perform the movement, but it has to deviate or to move towards the side. So overall, ma'am, upon conducting the range of motion assessment, you showed limited ability to perform the movements. Next, we'll be assessing the strength of the muscles of your thumb, fingers, and wrist to check if there's weakness to these muscles. So we'll be assessing your thumb muscles first. So I want you to sit next to the table and place your forearm on the table in such a way that your palm of hand is facing on the side. So I'll be assisting you, ma'am. Okay, so are you comfortable in your position? Okay, that's good. So now, using my one hand, I'm going to stabilize your bone over here. So this is your first metacarpal. So at the count of 3, please bring your thumb up so it points towards the ceiling, but do not yet move the end joint, okay? So do you understand the instruction? Very good. So now at the count of 3, I want you to do that. 1, 2, 3, and hold it. Okay, so now this time, please try to straighten the end of your thumb. Now 1, 2, 3, straighten, okay, then hold it. Okay, so after testing the left side, we'll be testing the right thumb. Next, we'll be assessing your finger muscles, so please remain in your position, seated next to the table, with your forearm on the table and palm of hand facing on the side. Now please bend your fingers, ma'am, so basically, landing position, ma'am. Okay, good. So now using my one hand, I'm going to stabilize your wrist. So ma'am, at the count of 3, I want you to bend your knuckles back as far as they will go, okay? So now, do you understand the instruction? Okay, good. So now at the count of 3, I want you to perform that. 1, 2, 3. Okay, so after testing the left fingers, we'll be assessing the right fingers. Lastly, we'll be assessing the muscles of your wrist. So please remain in your position, seated next to the table, with your forearm on the table and palm of hand facing the side. So using my one hand, I'm going to support your wrist. So this way, this will elevate your hand from the table and remove friction. So now, at the count of 3, ma'am, I want you to please bend your wrist back. So basically, yan yung movement, ma'am. So do you understand the instruction? Okay, very good. So at the count of 3, I want you to do that. 1, 2, 3. Okay, so after testing the left wrist, we'll be testing the right wrist. So, ma'am, upon assessing the strength of your thumb, finger, and wrist muscles, weakness was pretty obvious. Next, we'll be performing coordination assessment to determine your ability to execute smooth, accurate, and controlled movement. So I'll position myself sitting, and I want you to sit opposite me. So I'll be assisting you. Okay, so are you comfortable in your position, ma'am? So that's good. So we'll be assessing both sides, and let's start with your left. So please place your arms at the sides, and since we'll be assessing your left side first, I want you to bend your left elbow to a 90 degree. So like this. So I'll be demonstrating first what you will be doing for you to understand it clearly. So basically, you will be alternating your forearm. So alternately turn your palms up and down. Okay, so up and down. Margin na siya, ma'am. So do you understand the instructions? Okay. So at the count of 3, I want you to please do that. So you'll be doing this for 5 repetitions. Okay. So at the count of 3, I want you to please turn your palms up and down. Okay. 1, 2, 3. Turn up, down. Okay. Second. Okay. Third. Up, down. Fourth. Up, down, and then last up, down. Okay. So after the left side, will be performing the right side, and after testing both sides. So, ma'am, upon assessment, you're having difficulty performing the movement because you complain of pain. So, I have your questionnaire form, ma'am. So, this is your disability of arm, shoulder, and hand, or the Dutch questionnaire. So, as you can see, this is a 30-item questionnaire that looks at your ability to perform certain upper extremity activities. So, in each item, you'll be rating your ability to do tasks from 1 to 5. So, 1 being no difficulty, 5 being unable. So, do you have any questions, ma'am? Okay, so I have your pen and you may start answering. So, please take your time and tell me when you're done, okay? So, after the patient answered, so just wait for a while, ma'am. I'll be tallying your scores. Okay, so, ma'am, you gained a low score, ma'am. So this indicates that you have high level of disability of your upper extremity. So from this information also, and from the subjective information gathered, we can also say that the patient has functional limitations in doing her usual ADLs that involve the use of her upper extremity, especially the use of her thumb and fingers. So we will be performing the ULTT2B. So this is a special task to assess nerve compression of your radial nerve. So I want you to position yourself lying on your back, and I'll be assisting you. Okay, ma'am, are you comfortable in your position? Okay. So I'll position myself standing at the side to be tested. Now using my one hand, I'll be depressing your shoulders. The other hand will move your shoulder away from your body, so 20 to 30 degree. And then I'll be rotating your shoulder inward. Then turn your palm facing the floor. Now I'll be bending your wrist, finger, and thumb. Then I'll be slowly straightening your elbow. Okay, so ma'am, what do you feel? Oh, so you feel your production of symptoms? Okay, so after testing this side, we'll be testing the other sides after testing both sides. So ma'am, you complained of production of symptoms when you performed the test. So this means you're positive for this test, which indicates compression of your radial nerve. Now that we've gathered enough information, the first part of our plan of care is to educate you about your condition and to prevent production of symptoms. So your condition is posterior interosseous nerve syndrome. So this is basically a compressive neuropathy of the posterior interosseous nerve. So this nerve is located close to your elbow. So it usually has an insidious onset, often presenting with weakness in finger and thumb extension, or the ability of your thumb to straighten, and your finger to straighten. So please avoid activities that will aggravate your symptom. So as much as possible, I want you to please avoid bending your wrist, straightening your elbow, turning your forearm in a way that your palm will face the floor. So basically, please avoid activities that will cause you pain. Okay? So you'll be also having an above elbow cast. So it looks like this. So you'll be having this for 2 weeks, so that your elbow will be bent at 90 degrees. The forearm will turn in such a way that the palm is facing toward the ceiling and wrist in neutral position. So this way, you'll be this will avoid the production of symptoms, especially pain. So we'll also be using modality. So this is a TANS. So we'll be using this to relieve the tenderness on the area over your posterior interosseous nerve. So before anything else, we'll first check for any contraindications. So assuming patient has none, so we can proceed. So ma'am, now I want you to position yourself sitting, then bend your elbow and place your elbow and forearm above the table for support. So I'll be assisting you. Okay, so ma'am, are you comfortable in your position? Okay, so ma'am, when this is applied, I do not want you to make any unnecessary movements, and please do not touch the electrodes. So I also don't want you to fall asleep, so that you can tell me if you feel any unusual sensations, okay? So do you understand? So now we'll be placing the electrodes on the area of your nerve, so which is again close to your elbow. Then we'll be doing this for 20 minutes with parameters of 50 microsecond pulse width and 50 Hz frequency. So the first exercise that we'll be performing is the radial nerve glide. So this is to relieve the tension of your radial nerve, so which is associated with your posterior interosseous nerve. So first I'll be demonstrating the exercise for you to understand it clearly. So you'll be standing with your affected arm by your side. Then you'll be bending your wrist, straighten your elbow, and rotate your arm inwards, bringing your arm out by your side until you feel a mild stretch. So to glide the nerve, simultaneously move your neck away from the affected arm while rotating the arm outwards. So simultaneously do this. Then return the neck to the midline and rotate the arm inwards again. So you will do this for 5 repetitions. So do you have any questions, ma'am? Okay, so none. So now I want you to do that. So again, I want you to stand. Okay. Stand with your arm affected by your side. Now, bend your wrist, straighten your elbow, rotate your arm inwards. Bringing your arm out by your side until you feel a mild stretch. So you feel a stretch. Okay. So to glide the nerve, simultaneously move your neck away from the affected arm while rotating the arm outwards. So to glide the nerve, go. Okay. Now return the neck to the midline, rotate the arm inwards again. Okay, so we'll be doing this for 5 times. So second, now third, fourth, and fifth. Okay. Now we'll proceed to range of motion exercises. This is done to improve the ability of your thumbs, fingers, and wrists to straighten. So I want you to sit comfortably next to the table with your forearm on the table for support. So I'll be assisting you. So ma'am, are you comfortable in your position? Okay. So basically, ma'am, in this exercise, all you will be doing is straighten your thumb, fingers, and wrists. So you will be doing this for 5 repetitions of 2 sets, but don't worry because I'll be assisting you. So let's start with your thumb. So again, you'll be straightening your thumb for 5 repetitions of 2 sets. So let's start it at the count of 3. 1, 2, 3. Straighten. Okay, good. Next, 2, 3. Straighten, straighten, fast, straighten. Okay, so that's 1 set. Now we'll proceed to the second set. 1, 2, 3. 1, 2, 3, 4, 5. Great. So after performing thumb extension, 5 repetitions of 2 sets, we'll be now performing the finger extension with the same parameters, and then after the wrist extension with the same parameters. So if the other side is affected, then we'll be performing the same exercise with the same parameters. So in the next sessions, the patient can already perform the movements actively. We will proceed with adding resistance modes or manual resistance and elastic band resistance to strengthen the muscles affected. So we will be performing forearm pronation supination tests to improve your ability to execute smooth, accurate, controlled movement of your forearm. So I want you to please sit comfortably. So we'll be performing this on the right side first. So I want you to place your shoulders at your sides and bend your left elbow to 90 degrees. So this position. Okay, sorry, comfortable, ma'am. Okay, so basically, all you'll be doing is you'll be alternating turning your palms up and down. So this movement. So you understand your mom? Okay, so now at the count of 3, I want you to do that 10 repetitions. Okay, so 1, 2, 3, turns up, down. Okay, up, down, 2, up, down, 3, 4, 5. So basically, this will be done for 10 repetitions. Then after performing it on the left, then we'll perform it on the right side. So lastly, we'll also be performing functional training depending on the patient's usual ADLs and works. So functional training will be for 10 minutes, mainly to increase performance in ADLs.